Welcome to the Illinois Perinatal Quality Collaborative Labor Management Support e-modules. These e-modules were made as a resource to support hospital implementation of the ILPQC Promoting Vaginal Birth, or PVB, initiative. The aim of the PVB initiative is for 70% of Illinois hospitals to be at or below the Healthy People 2030 goal of 23.6% cesarean delivery rate among NTSV, or nulliparous term singleton and vertex births, by December 31st, 2022. Our goals include increasing the percent of C-sections among NTSV births that meet ACOG SMFM criteria for cesarean, as well as educating physicians, midwives, and nurses on ACOG and SMFM criteria for cesarean, including labor management strategies. Hospital quality improvement teams participating in the PVB initiative are working on 5 key strategies to reduce cesareans among NTSV births, including labor management support. ILPQC partnered with Jessica Brumley, the co-creator of the Florida Perinatal Quality Collaborative, or FPQC, labor support workshops, completed by over 400 nurses and providers in Florida as part of FPQC's Promoting Primary Vaginal Deliveries, or PROVIDE initiative. Jessica is Director of Midwifery at the University of South Florida Department of Obstetrics and Gynecology, where she leads a team of 14 midwives and advanced practice nurses. She also serves as an advisor on the FPQC PROVIDE initiative. In August and September of 2021, Jessica and ILPQC worked together to offer 2 live virtual labor management support courses for nurses and providers in Illinois. These sessions were recorded and broken down by topic into this collection of 14 e-modules ranging from 6 to 21 minutes each. We are excited to share them with you. Now I will turn it over to Jessica.
We all use this like numeric pain scale, but some have argued that this is really insufficient to assess the complexity of labor, and instead using a coping scale, we can assess how well somebody's coping. This has been Joint Commission approved, so that's something that that is sort of been okayed by them. And the use of a coping scale in conjunction with different, pain management techniques can help us to tailor our interventions to best meet the needs of each person. And this is the algorithm, the Coping with Labor algorithm that Lisa Roberts helped to create. And, it gives great examples of like, what does coping look like? What does not coping look like? And then what are ways that we can support coping, or things that we can assess, to see, where we can intervene. And they give, gives you suggestions from basically all the things, that we've, gone through throughout this presentation. And most people really like it. They feel like they're focusing more on the patient, and instead of this like, pain number, that it's really much more logical. And it allows sort of use of the nursing process. So one example is like, you can ask how you're coping with labor, and some cues, that she's coping is that she says she's coping, or she's got rhythmic activity, she's focused inward, and she's able to relax between contractions. And then, you can intervene if somebody's not coping well using these different strategies. So the next concept that I wanted to bring up to you is this idea of emotional dystocia. And this is something that Penny Simkinda has done a lot of work on. And emotional dystocia is, can be demonstrated in active labor, in many different ways. If somebody isn't coping well, they may lack rhythm and ritual, exhibit very needy behavior, exhibit sort of extreme modesty or high degree of muscle tension. They may appear jumpy or express fear of losing control. Um, um, so what are some reasons why someone may demonstrate emotional dystocia? They may have had a previous difficult birth or traumatic hospitalization, a physical, sexual, or emotional abuse. We know that there's a large percentage of our patient population that would have had this experience. There may be communication barriers. There may be cultural factors regarding nudity, shame, exposure to men. Also substance abuse, right? I find that people with substance abuse during pregnancy can be especially hard to be able to find a place of coping. And there may be fear of serious health problems related to self or baby, like even just a random little ultrasound thing that comes up in pregnancy that we don't think too much about can, can cause fears in our patients and cause them to kind of tense up. So that fear can lead to failure to progress for some of those like hormonal reasons, that we've discussed before. And so by soothing their fears, this can really be preventative care. So it's important for us to try and kind of get to the underlying cause. And so, if you see somebody who's not coping well, or, just really seems like labor is just stalled out, you might want to just really like get connected with them. How are you feeling right now? Or what was going through your mind during that contraction? Do you have any idea why your labor is slow? So I know that sometimes pre-COVID, there was a lot more people in the, in our labor rooms. And sometimes I'd have to try and get people out of the room just so I could really talk to women about, where their feelings were and try and get to the bottom of this. So I wanted to go through just some suggestions on communicating with patients and family education tools. How to suggest non-pharmacologic techniques. And that's something that we've had some questions about before, when somebody doesn't want to do something, or how do you encourage it? We have a hard copy menu of some of our options, so something physical that they can look at. And then also communicate with your patient about how she should express her concerns. Ask her specifically, what is it that she wants? Does she know about her different options? Review all the options as early in the process as possible. And maybe bring that hard copy and say, pick one or two or three. Talk about the benefits, education, right? I mean, it's so powerful. And when in doubt, I just say, I think you should go empty your bladder. I mean, because, who doesn't need to go pee when they're in labor? And it's just like a tricky little way to get them out of bed. This is an example of a menu of options that one of the hospitals here in Florida created. And on the back was just all these pictures. They call it the rock and roll menu. And so you can just say, pick from our menu, pick maybe one from each line that you want to try, or something like that. Yeah. So, but speaking about sharing information, somebody mentioned earlier something about birth plans, and I know sometimes they can be thought of kind of negatively, like, oh my gosh, she has a birth plan, or, it's only a certain kind of patient that has a birth plan. They could be super rigid and think everything's going to go a certain way. You really can't plan for birth. These are things that people commonly say. But a birth plan can really be a tool for shared decision making. And the California Maternal Quality Care Collaborative actually created one for the state. They, got all their experts together and they created one, and it was really simple. And sometimes patients go out there and they find these like crazy click box ones, and they click things that don't even go together. Like, I don't want an epidural, but I don't want an IV, but I want an epidural. And you're like, well, those things, you can't have one without the other. And so I like this one. It talks about what's most important to you during labor and birth. Like, what are your biggest goals or priorities? Please let us know if you have any religious or cultural practices, traditions that are important to you. And then describe any additional preferences, concerns, fears. And so these are all things we want to know about, and we want to be able to share, even like when we give a handoff, this can be a good tool for us to share, with the change of shift, and, or if somebody's covering you when you're on break. Lamaze also created one, and I like this one also. They always do such a good job with the graphics, and they break it down through the different sort of stages. So during labor, during the birth, for newborn care, just asking about their preferences, and it's all just on one sheet, which is nice because it's an easy thing to share. This is another Lamaze tool that you can use in labor rooms, right? We like to move it. And it talks about all of the benefits and the evidence, again, different positions. So this is another tool that is available. Mothersadvocate.org has some great patient handouts with pictures. So just, going through some examples, because it's not something we have to create ourselves. I mean, we're welcome to, but there are resources that have been made that are out there that go over the benefits and how to do things, and we can use them and just like, capitalize on them right away instead of creating something ourselves. And there's some patient education videos also. I think this one is from Parenting Channel. And so I was just going to show you one of them. So we're going to go ahead and watch this one, and so you can get an example of what that might look like if you have option of even playing it on our TVs or pulling it up on our phones or whatever. So we'll watch that now.
Hi, my name is Jessica Anderson, and I'm a certified nurse midwife at the University of Colorado Hospital Center for Midwifery. Today, we're going to talk about birthing positions. There are many positions that you can utilize during the first stage of labor. One of the positions that you can use is a sideline position. This position is wonderful for early labor as it allows you to rest during the contractions. Often women are able to get a little nap in between their contractions, and you don't use a lot of energy with this position. So it can be really beneficial in those early stages of labor. Another wonderful position is the hands and knees position. This is great for the first and also second stage of labor. For first stage of labor, it's nice for women who are having significant back pain. Getting this position can help your baby rotate, and it also allows for your support person to give you some assistance with massage or pressure on your lower back. Another position that's really beneficial for the first stage of labor is standing. Typically, this is a position that women use in the first stages of labor or the early stages of labor. It's nice because it can help promote progress in labor. It also can promote comfort and decrease pain. Typically, what women will do is they will stand, and then when they have a contraction come on, they will utilize a support person to almost do a type of slow dancing position. They will utilize this position during the contraction, and then will typically stand up when the contraction is over. Another wonderful position to utilize in the first stages of labor is walking. Walking can actually help promote progress in labor, and it can actually help your baby to get into a wonderful position to help the birthing and labor process. Walking is nice as women are able to walk, and then when they have a contraction come on, they can stop and do relaxation techniques to get through the contraction. Typically, walking is something that is used more in the early stages of labor. The sitting position is also a great position to utilize in the first stage of labor. There are several ways that you can use the sitting position. You can use a birth ball, a birth stool, you can sit on the side of a bed, and you can also use the bed at the hospitals to get in this type of position. This is wonderful as it allows women to rest between their contractions. Women can lay their head back in between, shut their eyes, and get a little nap. It's also a great position as you utilize gravity to help your baby drop and settle into your pelvis into an optimal position. Another wonderful position to utilize in the first and second stages of labor is the squatting position. The squatting position is wonderful as it opens your pelvis and helps facilitate your baby getting into a wonderful position for birthing. The nice thing about the squatting position is that women are able to pull themselves up into a squatting position. They then push during their contraction, and when they're finished pushing, they can sit back into a more supported position to conserve their energy. Another position that you can utilize for the first and second stages of labor is an upright position on a birth stool. Birth stools are wonderful as they help gravity and help your baby settle into a wonderful position in your pelvis. It's also a position that you can utilize for pushing as well. This position is nice for pushing as it really helps you get a powerful push because you're in an upright position, and it also allows the mom to be very involved in their birth. In the first stages of labor, the birth stool allows your support person to have access to your back if you're having a lot of back labor or pain. Your partner can give you pressure on your lower back or can also massage your lower back as well. The birth stool is something that can be utilized in the second stage of labor. Women are actually able to push and give birth in this position. If you're having a birth on the birth stool, your provider will typically be on the floor, like I am, and will support your perineum and assist your baby into the world. One thing that has been found for some women, particularly women having the first baby, you can have larger lacerations on the birth stool. So often, if you are having your first baby, your midwife or provider may suggest that you only push in this position and give birth in a different position.
So that's a great source of information and really like quality made. Like you don't have to, recreate something when there's, quality videos like that are out there, whether it's something that you share with people in labor or make available as a resource on your websites or social media pages, that kind of thing. So that's just one example of some resources that are out there. And let's see. Okay, another handout from Lamaze. This is one from the American College of Nurse Midwives and their Share with Women series. And these are some patient education websites that I've mentioned before. So great resources, and some other great resources for nurses. The Labor Progress Handbook by Penny Simpkin is like a little bit of like a, Bible. It's like a reference tool that I'll just pull out and open up and get ideas from. Spinningbabies.com. There's lots of videos and resources there. And then your own ILPQC and FPQC websites have great resources available for education of patients and staff. So, as some take-home points, consider using a labor preference checklist. This is something that you can use even for people without a birth plan. And it's, part of the nurse's role to promote physical and psychological comfort for women. Now, hopefully you have a few more tips and tricks to use for that. So we should individualize our care and try everything that we know to promote comfort and progress, and hopefully also prevent cesarean sections.